Hi everyone. So I'm here to show a case and share a case with you actually. So it's a case of submerged tooth, okay, with the tooth 36. Now, if you many people whether doing general practice, there are times when we are not much aware about the thing clinically, so we have to go into details by seeing the radiographic view. Now, since we have this advantage today of CBCT, so I'm going to show you quickly as in what all things being a dentist or being a radiologist or being a student if you are, whatever you need to see in a case of if you have a submerged tooth. So now we'll go to we are here using the software that is 3S 3D imaging software, and we'll move to the oblique slicing. Now everyone, all of us know that what is a submerged tooth. It is basically a tooth which is not able to erupt up to the occlusal level, like if you compare to the adjacent teeth. Now there can be n number of reasons. It can be a genetic or this adequate mesiodistal arch space, you can say, is inadequate for the tooth to erupt up to the occlusal level, or maybe ankylosis. So there are many causes which are definitely the theoretical part. We'll not go into it. We are just here mainly concerned as in what all things the dentist needs to know about this particular tooth. So here, if we see, you know, the first thing which comes to my mind when I see this tooth is, first of all, okay, the tooth 36 is submerged. Now, as you can see, the occlusal plane is, at the level of nearly the CJ of the adjacent teeth. Now, this tooth is causing cervical caries since it is in close contact, you can say, with the, or its abuts actually, the mesial cemento-enamel junction of the adjacent tooth. So it is causing here cervical caries. That is the thing which is of concern, because if this continues, if you don't go for any treatment option, then along with tooth 36, this tooth 37 will also undergo more and more damage will be caused. Now, the next thing which comes is, if you can see, the alveolar crest is basically, you can say, alveolar process is underdeveloped. So the crest is not at the same level as compared to the adjacent teeth. Like of the adjacent teeth, we see where is the crestal level is here, whereas for the tooth 36, the crestal level is here now. Now, this tooth, if we see, there is something, it's not like a normal tooth, okay? First of all, there is a lot of resorption is there in this tooth. Moreover, prior to going for the resorption, if we talk about the roots, as you can see, okay, we go to the coronal slicing. This is the mesial root. Now the mesial root is bifid, okay, it has two, it is bifurcating into the buccal and the lingual terminals, and the same is the case with the other root, that is the distal root also. I go with this, I place my the axis here along with the long axis of the tooth, and again, as you can see, it bifurcates into buccal and lingual terminals. Now definitely the dentist needs to know how the canal is associated, what is the approximation of the canal with this tooth. So what's happening is, the canal is here. So what is happening, you can say, it's passing through the apical notch between these terminals, and it's getting mildly compressed in these regions, okay. Similarly here, if also you see, here the canal is getting mildly compressed, okay. If I just hide the canal and you see, hide the it, and now if you see, this is a canal, so it is getting mildly compressed, and it is passing through this notch, okay, this notch which is formed between the terminals. Moreover, as I discussed earlier that one of the causes of these teeth are submerged teeth, that ankylosis. So here you can see, you can't appreciate the if you see the root, you can't appreciate the perial space. So definitely there is ankylosis in association with both the mesial as well as with the distal roots, okay. Now this is concerned about the roots, their the association with the canal and the crown. Now if I go in detail more, as in what all things, if I want to know about the resorption, so again that's a very important aspect. So definitely this treat doesn't seems to be restorable. Now you go on the axial slice, okay, here. Now I'll keep on moving my cursor from the occlusal view. I'll keep on going apically, okay. So I'm moving my cursor, I'm moving it, moving it, moving it. Now can you see here, here is the point from where the resorption is starting. So here, if you see, this is the entry point. So basically it is a case of cervical external resorption, and if what is the entry point, there is a focal entry point, you can say, not a large one, but a focal entry point is a focal one along the lingual surface at the lingual cement to enamel junction, and from here starts your resorption. So you can see how extensive is the root resorption, that is extensive cervical external root resorption in this case. Now as we move further, what is happening? The resorption is extending along the lingual aspect of the pulp chamber as well as here. So you can say that there is cervical external resorption, and it is involving the radicular dentine, and moreover it is extending along the both, and it is communicating, you can say, actually with along with the lingual as well as with the buccal aspect of the pulp chambers. This resorption is communicating on both the sides. Now if we move on further, we keep on moving. So what is happening, this resorption is actually extending to the furcal floor here. Okay, this resorption is extending up to the furcal floor. So you can say that it is perforates the pulpal floor. Now if we talk about the roots, even if you see both the roots in detail, that is the mesial root. First we see the mesial root. So what is happening, this resorption is involving nearly coronal third of the mesial root here and here, both the buccal and the lingual aspect, as well as on the distal root. If we see, here also what is happening, the resorption is involving, see, the coronal third of the root. So in brief, if I say what is happening in this case is, that is the entry point is liqually, the resorption is extending the radicular dentine, the coronal dentine, both on the lingual and buccal aspect of pulp chamber, and thereby involving nearly coronal thirds of the roots. Now since this resorption, it is subcrestal, so it is very the chances are very less that this tooth is restorable. It definitely has a poor and a questionable prognosis. Okay, so yeah, this is a small case of submerged tooth which I have shown here. If you find any queries you have, or if you feel like anything, we'll move on to a next case in the next round. But by the time, definitely message in the comment section whatever you feel. Okay, any other doubt you have, or if you're not able to understand anything, if you are keen towards learning radiology, or you have any case, if you have any query in any case, then also you are most welcome, and you can share any case with me. If you have any doubts, I'm here to help you out. Okay, so stay tuned, and we'll have a quick view at a next case in the next video. By the time, just have a look at this case, and please write in the comment section whether you like this case, whether you like the pattern or not, and in case you have any query regarding this particular list, then also do let me know. Thank you.